Slow-Transit Constipation, STC, occurs when the colon's ability to move stool effectively is impaired. In STC, stool remains in the colon for extended periods, leading to increased water absorption and hardening. Unlike normal transit constipation, STC is characterized by a primary motility issue within the colon itself, not the rectum or anal sphincter. Symptoms of slow-transit constipation, STC, include infrequent bowel movements, typically less than 2 per week, and hard, dry stools. Patients with STC may experience a persistent feeling of incomplete evacuation and notable abdominal bloating and discomfort. Underlying causes of STC can involve neuromuscular dysfunction, enteric nervous system disruption, or idiopathic factors. Diagnosing slow-transit constipation, STC, involves colonic transit studies, anorectal manometry, and defecography. Treatment for STC typically begins with lifestyle modifications, including a high-fiber diet, adequate hydration, and regular exercise. Laxatives, prokinetic agents, and biofeedback therapy are used to treat STC. Subtotal colectomy is considered in severe cases.